first time I did this group discussion, it was supposed to be 1 hour, it went up to 2.5 hours. So it just took a lot of time because what happens is students do not know where to stop, how much to present. So they keep on doing whatever is there in Shalakya, they will keep on telling you the same thing. Speaking skills, audience engagement, and question handling. So if there are questions, then you can put these points. Otherwise, audience engagement also is an important factor. So all of the PowerPoint presentation should be assessed on these criteria. That's a general idea of you can have one or two more criteria to assess the, but again it should be uniform to all the students. Then again there is a problem-based learning in our syllabus. In NLHT, in theory class, non-lecturer theory, it is about ectropion and entropion. And as discussed in the morning, you can share these details via messaging devices, but usually I do not. Phase 2, you introduce the problem that you give two cases. Here I have given two cases. One is about entropion, other about ectropion. And then there is discussion, which is for 15 minutes. So again they go to the whatever material they have or the material which I have provided to them, and they will go through that and they will analyze these cases. They will brainstorm possible causes and formulate initial hypothesis. Then fourth is to find out the solution, the treatment part of that, and last is the group presentation. Now here for group presentation we have only 1 or 2 minutes. So because there are multiple groups, we have around.
Students, if you send them to they will not come back.
Correct. So there are two options. What I do is I don't send you library. I ask them to use internet. Because they already anyway they are during lectures they are on WhatsApp. So it's always better. This is the best way. In library there are some classes which we can take as a library class, but again you have to monitor that. So you give a particular topic, send them to library, and librarian monitors that. And then after the library hour, they come back again and then you assist them.
Sometimes there is no capacity.
Pardon?
We send the whole class
Yes.
in the library.
Yeah. So all these practical problems would come. So according to that, you have to choose what method you are going to use.
The other people are also there.
Pardon?
Other students are also there.
That's what I'm telling you. It all depends on the capacity of the library. And that's why the best solution is using internet.
काफी लाइब्रेरी सेशंस हैं इसमें.
इसमें है स्टूडेंट आते नहीं लाइब्रेरी भाग दिए है कौन से
That's why.
New library cards are important.
That's why there are or. If you go through the syllabus, again there are 2-3 methods are given. This or this or this or this.
We get really from the students.
Yes, yes. So in PBL again, these problems, I mean these are the assessment criteria, how the people are analyzing the problem, what kind of research and application they are doing, what is the proposed solution from them, is there any collaboration in between them, and what is the presentation. So depending on that, again these are the indicative points which I have mentioned. Next point is about group discussion. Now group discussion, again you have to give information a week before about eye banking disease. Then you introduce, especially for introduction of group discussion, you have to have some certain kind of question which will kick off the session. For example, in case of eye banking, what do you think is the biggest challenge in increasing eye donations in our country? So these kind of thought-provoking questions, if we start asking, then they may think about it. The students may think about it. Then there will be a group discussion between themselves. 5 to 6 students per group, around 40 minutes, and you have to give them certain questions. The same questions, like for example, what is the role of an eye bank? What are the key steps from a donor's passing to the recipient surgery? Discuss the critical criteria for donor selection. What are the key differences between the whole eyeball transplant and a cornea transplant? So all these things we should tell right from ethical, legal considerations surrounding eye donation, including the principles of informed consent. So all these problems, all these questions should be delivered to them and asked them to discuss about it. So the discussion remains on track. And ultimately, last 5 minutes they share what it is. It is important that they do not present everything again. In this kind of discussions, the presentation is not important. Important is what they have learned within these 1 or 2 minutes. So, assessment criteria. So, when this discussion is going on, happening in your class, you are supposed to check out how much actively they are participating. Then, you would be discussing with them. When the group discussion is happening, we will be amongst them and you will be discussing certain points with them. You would find out whether they are able to understand the concepts, processes, terminology, how much critical thinking they are demonstrating, and in between, what is the as a role of team member, what they are suggesting. So one of the methodology was group discussion, and these are the points which you can understand as a part of assessment. Again, as I told you, you must tell the class before assessing, at least 7 days or 15 days before, that this will be assessed. 100 marks I have written as a generalized understanding, then you get 10 also. When you get 100, then you have enough flexibility to go from 41 or 42 or 43. That's 100. Surgical procedures, how to teach surgical procedures in class. The best is to show recorded surgical procedures so that they have a realistic view of the process, which will take around 45 minutes. And as sir was showing, you have to pause at the key moments to show the typical important steps. That's very important. It's not that you just, turn the video on and you can be on your mobile. This should not be there. It's a class. Provide, this is also important. You should give them a checklist beforehand. So again, NLST always is a pre-class, something is given. So give a procedural checklist. As far as these are the procedures, these are to be checked out over there, and they should be able to check it during the procedure. Summarize key concepts and complications. That is the last 5 minutes, wherein you can summarize the session. Allow students to ask questions and clarify doubts. Important is you tell them about sterile techniques and various kinds of procedures. And these kind of surgical procedures can be presented as a part of assessment by posters. So posters like these about septoplasty or this about septoplasty can be a part of assessment. Now when we check the posters and when we put them as a part of assessment criteria, what are the assessment, the points of assessment should be there. Of course, first is content accuracy and depth. So as you can see over here, it's all wonderfully placed, as well as the contents are proper.
They have to prepare the poster.
They have to prepare the poster and present as a part of assessment. So last PT was on one like 10 marks were on the assessment. So they were presenting a poster. Sorry, it was about poster. So they presented a poster about I think Ashura during examination. So everybody has to bring some poster about Ashura. And then how we'll assess? We'll assess on this. So instead of taking Viva only, कि आश्रय के प्रकार क्या है, ये वो तो है, लेकिन if you have some different
exam we do that.
Yes.
Yes. Like the main exam.
They make the posters at home. And
Yeah, they will make something nice manner.
Yeah.
And they come
Okay.
and bring master.
Yeah, that was a good
Main
idea.
exam.
Yeah. So visual design and layout, again if you can see into this, it's a wonderful design given over there. Organization and clarity, verbal presentation. Okay. Another common type of methodology is flipped classroom. So flipped classroom is again a concept wherein the students form a kind of teachers, and that's why it's called a flipped classroom. So you have to give information before and pre-class. So maybe in case of Professional Shastrakarma, what we can do is we can give them a video lecture, a pre-recorded video lecture, where it should cover the definition, pathophysiology of Professional
They come and teach.
Yes, yes. Indications, step-by-step demonstration. You can also give them reading material. And in class, which is 50 minutes, again, usually flipped classroom, it is better to start with some question and answer or some quiz. So they are into subject. And then you make groups. So 100 students are divided into 10 groups of 10, for example. Each group is given a printed case study. For example, this is a study. A 60-year-old male presents with gradual vision loss, etc., etc. As a surgical team, your group must discuss and prepare to present on the following points. Justify the need for Shastrakarma, that is indications. Outline the key procedures of surgical procedure you would perform. This is about proposing about the situation about it. Identify and discuss at least 2 potential complications. How do you
I
manage?
think this chat GPT will give all this.
Can be given. Yeah, can be given. Yes, correct. And then again group presentations, which is for last 15 minutes. So in last 15 minutes, you would ask them to present what they have learned. Again, if there are any corrections, you must do. The assessment will be for 10 minutes, pre-class as well as quiz. So pre-class preparation is a brief pre-quiz. 2 marks are given for that. In-class group contributions, how they are discussing, what is the participation, is there active engagement or not, or just they are sitting over there, if there is any help to each other. And last is quiz. Again, post-class quiz you can do. There is, the quiz format is, this also is fine, like 5 MCQs and 1 short answer question. Or you can decide. Or then you can use Mentimeter to prepare quiz or even Google Form. Next is about brainstorming. Brainstorming on Shirasottamanga. So what is actually brainstorming is, it's a wonderful idea wherein the student starts thinking. And there are some various concepts which may be foggy, which are not clearly mentioned. So in these kind of concepts, for example, Patel. So we can ask them to find out the solutions. Maybe there could be some good ideas which are coming up. So in brainstorming there is nothing wrong and nothing right. Every idea is welcome, that's very important. So judgment is not, you should not be too judgmental about it. So a prompt is given and then the discussion is taken. It's important that they give good ideas, multiple ideas. There should not be any criticism. Whatever idea is there is always welcome. Ultimately, at the end of the day, you should be able to find out some kind of material. So when the session is over, you will have an idea why Shira is Uttamanga. So for example, if you go back to the slide over here, yeah. So when the discussion is going on, some people are there just to take notes and they will form the final essay about Shira Uttamanga. There will be 2 or 3 people who will be making the essay, who will be making the points which come through discussion, and they will present the final, that will be the final case. There is one issue about headache, discussion on headache, where study groups are formed and they share information. Here they will be presenting for 15 minutes. They have various methods to prepare. Now, important is how to assess, how to attend open book test. Now, open book test may be an easy formula for the student, but it is not so. The questions which are created for an open book test should not be direct questions. These should be questions where there are 2 things. One of the things is you have to give the questions in such a way that there should be some thinking happening, and number 2, there should be a time limit. Within 2 minutes you have to answer this question. When you have these kind of time limit, then obviously unless and until they study initially further before the class, they are not able to answer. So open book test is important. We design application based questions. For example, what is the function of the cochlea? Could be a normal question, but a patient presents with high frequency hearing loss after being exposed to loud noise, based on your knowledge of the physiology of the ear, explain the most likely mechanism of their hearing loss and the specific structures involved. So this could be a little bit thinking question, and like retrospective thinking they can do and write down the answer. A strict time limit is very important, and you must give the, the structure should be proper, rather than having now what should you tell the student? First of all, do not skip preparation. The open book format is not a substitute for study. You should study as if it was a closed book test, and focus on why, not just what. So the reasoning behind the physiological processes or clinical scenarios is very important. You can use textbook to confirm specific details or to find a key term, but the bulk of the answer should be own explanation. So that is the clear indication, clear instruction given to them, and the answer should be directly given with proper terminology, because it's a open book test. Now, how do you assess this test? Conceptual understanding, a deep understanding of the physiological principles involved, including the complex interplay between different structures of the ear, how the sound vibrations are transduced into neural signals, for example. Application and clinical result. The student is able to apply physiological concepts to a given clinical scenario. For example, explaining why a certain type of hearing loss occurs or how a specific pathology affects sound transmission. So this kind of logical answer should be there. Clarity and coherence. The explanation should be well structured. You should understand what they are telling, what they are writing, and accuracy should be there, because the terminology especially is very, very important. Another teaching methodology is role play, which we just talked in the morning. So again, you can create a scene where the health worker is sitting with a family member discussing the National Program for Prevention of Deafness, Prevention and Control of Deafness, NPPCD. And you can again make a scenario like this, a simple scenario where the housewife will say, "Thank you for coming in today, it's a great," etc. Health worker and family member. About surgical procedure, this point was left in the previous slide. The procedure checklist is important. When you describe the tympanoplasty procedure, for example, as a part of NLHT, then when the video is on, before that, the checklist should be given to the students, and they would match the contents in the checklist and what is happening over there again. So preoperative assessment, patient positioning, anesthesia, intraoperative phase, then what the surgical team is about, which are the equipment, what is the incision, so whether it is post-auricular, end-oral, or transcanal, how the graft is harvested, from where, and then middle ear examination, ossicular chain examination, when you elevate. So all the steps which are there should be given. This is an example of that. So should be given, because you will be assessing them. You will be assessing them with the help of OSCE. So again, in OSCE, because tympanoplasty is not supposed to be done by our graduates, we will assess them accordingly. We don't want them to do tympanoplasty at UG level. That is, after PG they can do. But again, in station 1, you will have one scenario where you can tell you are a junior doctor in the ENT clinic, Mr. Abdul Narayan D'Souza, a 45-year-old male, has a chronic central perforation of his right tympanic membrane following the previous ear infection. The consultant has recommended a tympanoplasty. Now, you must give clear instruction to the student that what they should do, like introduction, then explanation about diagnosis, then the procedure. In the procedure, what are the indications, what are the possible benefits, what are the risks, what are the complications. So all these names should be given to the student, and they should be telling all these things to the supposed to be patient. Any questions? Then similarly, a patient script should be given to Mr. D'Souza, and informed consent form template. That is station 1. Station 2 is post-operative patient counseling. So a patient, Miss Stacey Graf, has just undergone a tympanoplasty. She is in the recovery room and is about to be discharged. Then there are some instruction to the student, like how you will introduce, then what is the expected post-operative outcome, then whether about food care, activity restrictions, registration dues, about all these things, whether they have been clearly instructed. Um, so these kind of questions you can give to the examiner. Say the patient's husband may ask, when can she fly again? What if the ear starts to bleed? And then post-operative instruction handle. So these kind of station 1 and station 2, you can make and again assess them. So these are the various teaching methodologies which we have taken into consideration when we do NLHT. Most of the time it is through PowerPoint presentations or flipped classroom. These are the commonest versions. But whenever possible, brainstorming or group discussion also can be incorporated. As always, problem-based learning is the best method again, because then again you are taking a lot of, students are taking a lot of pain to research and everything. What I would do over here is, this is what we expect from this syllabus and from all of us. The planning is done, like we have known what are the objectives, what are the questions, predictions, who, when, how, where, everything is been done in syllabus. Now we are in the second phase, let's try it wala phase, where we are carrying out plan. There could be document problems, as we have understanding, there could be data analysis, and then we have to study whether it is working or not. Before CBME or before CBDC, what was the condition, now what is the condition. So this kind of study has to be done, and ultimately the action, what will be the next, whether we can try something else, what could be the next cycle, whether we will be committing some more, implementing some more ideas, and that's how the whole of the procedure will go. I think this is the end of the session. So ultimately what I would like to tell you is that competence leads to experience, knowledge, skills, behavior, performance, goals. All these we have to assess when we are assessing competence. Thank you very much.
Thank you so much, sir, for this inspiring and thought-provoking session. Your insight into modern pedagogical approaches will surely motivate all educators and learners. Now the doubt session is open.
If you have any doubts, you can question, because you are all teachers, and when you are teaching, you face lot of problems, so you can discuss. One thing I have seen, in my children are studying in Bangladesh, they are doing MBBS. So they are, this thing is so, each the anatomy exam if they have 8 to 9 tables. So in first table, they have to make a landmark of different structures. So depending upon the measurements, one attendant will be sitting there. So lungs, they have to take the accurate measurements on CT sternum and different points, and then they have to make arrow type, and then they have to connect them. So that, or if they are taking this thing, lateral side of the right, they have to draw the structures, lateral side of the face or something, what structures come there. Then they have some specific questions. It is very deep. Like even I was, then brain section, what are the structures, how it is linked. So in that way, one station will be free. So in each station they will be given 5 minutes or 10 minutes. So they have to complete that task within that, and then they have to go to next section. So in that way, one station will be free where they can relax. All the stations, 8 to 9 stations. So stations means they have made it like a table and one activity there. So each time they have to finish their, one this thing will be there, bell will ring, so they have to go to the next. So that is done for their exams. So that way it is very nice. So I saw their questions also, it is very nice, deep, so that we can assess the knowledge of the student. And when we have to give marking for the best student, then we can assess it in a better way. So in that way knowledge will grow. That's why that was the intention, I think, of sir. So that's why it will be practical based, and they will know how to do. What structures come there, what is the anatomical significance, everything they have to write down. There will be set of questions which will be little superficial also, some will be very deep. So in that way we have to gauge the students' capacity, what grade they have got. Easy questions, some difficult and very difficult. It's very difficult, those who answer, their grade will be raised naturally. So that way.
So that's why in syllabus also we have these must know, desirable to know and nice to know.
And when we are preparing the questions for any interview or any this thing, we follow the same system. Like, very easy also will be there, at least 60% easy. Then medium will be around, little difficult will be around 40 like that. Then that ratio is maintained. And very difficult only for those who have studied the subject thoroughly, and they will get the best marks.
Discussion, how do group discussions, how do you assess? Because some students will.
That participation will not be from.
Yes, participation should be there.
Even I have noticed.
That is
Only
what-
few,
that is
one
what
or
is
two
to be
will
assessed.
participating.
That is what is to be assessed. Two things are there. First, we must promote them to speak. There will be always in a group there will be one or two dominant people, and other people would not speak at all. So it is always there. So that's why in group discussion we have to move around. Along with them we have to sit and discuss. So that we know that this particular person is not speaking. So we have to ask them or promote them to speak, push them to speak. And that is a part of assessment also. If they are not speaking even after doing that, then that teamwork marks go down. So as a part of assessment that part comes. Not only content but also the participation in the discussion. And what again these dominant people, how much they are allowing others to speak about. That also is very important because you can see from the body language. So it all goes to communication. It's called a psychomotor domain. We have in Bloom taxonomy is a psychomotor domain, where or affective domain, where you are doing something as well as affective means you are understanding emotions. So when you talk to the patients, the emotions are important. What patient are telling, what he wants to ask. You tell something, maybe इसके लिए woman जरूरी है, woman का ये करना है. Then you understand how he is going, where he is going. He is ready, he is too afraid, and then you put your further deliberation. So he may be ready for woman. So this communication skill also, which is called the affective domain, will be studied into this group discussion. That is what is the idea.
And if we give PPT also, like to prepare a PPT, one or two groups we form, only one or two students will involve. Rest will they will do. That's it. Those are classes.
So what about practicals? In practicals also, in 2 hours, so it is very difficult to cover and assess. On that day only they want to assess the students. So 1 hour if you are taking the practicals. After 1 hour, if 50 students are there in one group, so how to see individually it will take time, sir. Minimum 10 minutes.
No, that's why what I feel is there are two methods of assessment. One you assess at that point when the student is learning or doing whatever it is. Say Karpan he is understanding or Ashtokan Bukwa is doing or he is seeing. That is one thing. So you do assess at that point or assess at the part of PT1 or summative examination. So these stations which I talked about is about summative examination.
But it is asked every practical class will have to assess all the students.
No, one day
You have to see the document.
morning they have kept it theory and afternoon they send us for practical. So in that way what we did, we have 120 students. So we had divided among all the faculty members, 20, 20, 20, 25 we did this time. So 25 easily we can cover in 1 or 2 hours. And we had prepared a set of same questions everywhere it was distributed. And that was his station. And we were asked.
So it is not necessary that every practical should be assessed immediately.
But it is given.
But
It is given because it is ideal.
Ideal, but you have to prepare the result also.
Yeah, the result will depend on PT1. So if you are not able to do at that point, if you given as you said, if 1 day is given, if this year you will be having Viva or whatever it is. So on that day always we can assess. Ideally you assess at that point.
In practical, it is different scenario. Like they come to us as per the syllabus. Assessment we cannot do. Because as such, what difficulty we are having, we cannot teach the students. Like how we used to teach that topic, it has to be completed within their day. For Pratisha, so less time they have given. It is such a big topic. Everyone is facing an issue. Syllabus next topic is Mother Nature. That will finish then very critical.
Now we request our organizing secretary and HOD Professor Shalakya ma'am to present